In this third and final video, we will demonstrate how to connect your new IV tubing to your CVC or PICC line using a sterile process. First, you will want to gather your supplies, which will include a pair of sterile gloves, 2 sterile gauze 2x2s, 1 sterile gauze 4x4, alcohol wipes, or chlorhexidine wipes. Remember that if you use a chlorhexidine scrub or wipe to clean the base of your cap, you will need to scrub for 30 seconds and allow it to dry for 30 seconds, as opposed to the 15-second scrub and dry with alcohol wipes. For this process, you'll want to open your sterile gloves first and use that to create your sterile field. You can then open all of your supplies onto the sterile field. Once all of your supplies are open, you will need to don your sterile gloves. Next, because your central line is not sterile, you will need to use your small 2x2 sterile gloves to pick up your central line and place the sterile 4x4 underneath to create a sterile field for your cap change connection. Next, using your gauze, pick up your central line and using your alcohol or chlorhexidine wipe, scrub underneath the hub to remove any bacteria or debris that may have built up. This will prevent the bacteria and debris from going into the line when you disconnect your tubing. Once your 15 seconds are up, you can now begin the process to connect your new IV tubing to your central line. Using your other 2x2 gauze, you can disconnect your old tubing, making sure to either clamp your CVC or PICC line or kink it to prevent blood from backing up into the line. You can then discard your old tubing. Using your other 2x2 gauze, you can now pick up your new IV tubing, remove the cap, the tip of the cap, and connect your tubing. You've now successfully connected your new IV tubing, transducer, cap, or drawn blood cultures according to a sterile process.